Hey, how's it going?
Good, good. How you doing?
Actually, pretty twitchy. I held back on the CBD dose intentionally this morning to see if we get a good before and after, which I'm pretty confident we're gonna now. I've only had 50 milligrams so far. On a day
Okay.
like today, I should be having about 150 to start to calm this tonic stuff down. Um,
Yeah.
Getting a lot of neck and upper back spine erector muscle cramps.
Oh boy. Boy, oh boy. And yeah, on those days, like you said, usually 150 milligrams ish.
150 to start usually goes in my morning decaf coffee, so it kicks in fairly quick. Along
Yeah.
with I take small dose clonazepam and baclofen and gabapentin, and if I miss anything, this is what happens. I've stopped everything cold turkey a couple times for 6 to 8 weeks, and same results. I get through it for a little bit, and then everything comes back. And that was a couple of years ago, and things have gotten worse since then. So I've obviously not stopped taking my medication because it's not a function of the medication or an interaction or whatever, because it would have cleared up when I went cold turkey. And I ate a whole food diet, drank nothing but water, and I cut out the coffee and caffeine while I did all that to eliminate everything else as a possibility for the dystonia.
Yeah. Yeah. And those meds, the like the baclofen, the gabapentin, did you say you stopped those or you're on them still?
I'm on them now. I stopped them when I stopped everything for a while to see if I was maybe having a reaction to any drug. I actually forgot to take my Ramipril for my high blood pressure for a few days. And I forgot a couple doses because I'm just bad for forgetting stuff from a long time ago. I'm on the autism spectrum as well. And I was like, you know what? I've read plenty of stuff where dystonia could be caused by different drugs or different toxicities or buildup. So I was like, I'm an engineer. Let's see what happens. So I just did my own experiment quietly. And the result of which was it definitely is not an interaction or a food allergy or
Wow.
anything else. Because 2 times now I tried it cold turkey to go off of everything, a whole food natural diet, nothing but water, cut out the caffeine, everything I could. And then
Yeah.
it was just a quiet before the storm. The storm would blow up again, and then I go, okay, clearly it's not the drugs. Then I'm back on the beds, and then CBD has helped greatly with that.
Yeah. Well,
To
let's
that effect, I'm going to take some of my high dose 100 milligram strength per milliliter here. You can see I'm having a bit of a hand tremor too. It's not a particularly good day. It's not the worst day I've had either.
yes. Yeah. So you are drawing that up because it's time for your dose because without
Absolutely.
your CBD, you obviously have.
This is completely involuntary, this tremor right now.
Yeah.
So I'll wait it out and then I'll get this dose in. And
Yeah.
then hopefully things will calm down very, very shortly. Usually only takes about 5 to 10 minutes if I let it sublingually dissolve under my tongue.
All right. All right.
Fidgeting.
Definitely had. Okay. Well, now that we've got that in your system, we'll keep an eye on things. I'll get started with a little formal intro. Okay. Like we've got all
Sure.
that. Okay. Hey, everyone. Welcome back to the Cover Cannabis Project. I'm Dr. Blake Pearson. I'm a family medicine physician who focuses on cannabinoid medicine and has done so for the last 7 or 8 years. And what we're all about in this project is talking about coverage. So, this is a medication that helps a lot of people. There's a number of conditions with evidence that patients benefit from in using cannabinoid medicine. And we're trying to raise awareness for coverage. So, today we have Matt, who is here to tell us his story. And, Matt, why don't we start out with just telling us your diagnosis, what your neurological condition, your diagnosis to start.
Sure. My neurological diagnosis, my main problem is I have a rare movement disorder called generalized dystonia. In my case, it's severe. And it can be caused by many other diseases and drug interactions. I've seen many neurologists, and we've eliminated many possibilities, and we're down to it's either caused by a neck injury I had through work, or I may have Parkinson's, which is symptomatically just severe generalized dystonia is effectively the same thing as Parkinson's. It's kind of the chicken or the egg situation.
Okay. All right. And when it comes to, you and I getting started with cannabinoid medicine, what were some of the symptoms you were hoping it was going to help with?
Well, at first, we started with low dose for anxiety with CBD and indica at bedtime, and that actually helped to reduce my anxiety enough that I was able to successfully go to therapy and make a big difference in my life. So that was a very positive change. And then I kept up with that to really it pretty much reduced my panic attacks quite a bit, and anxiety attacks and general anxiety. And basically, I find if I don't take it, all that kind of creeps back in, which is part of the other diagnosis of my neurological function of the dystonia or Parkinson's. Basically, it's a function of dopamine not circulating properly in my brain or not being produced by it. We're not quite sure which it is yet.
And so, very beneficial for you for anxiety, especially getting back into counseling and getting some of those benefits. But of course, with your neurological condition, maybe just walk us through the symptoms of kind of what you're like without your CBD, THC, and what you're like symptomatically after you take your medication.
Sure. Well, a great example earlier, before we started the podcast here, I was having what's called a dystonic storm, where I was having tremors, muscle cramps, severe painful muscle cramps. The best I could describe it as is if a giant was trying to rip pieces of muscle off my body. That's all calmed down. I've taken 100 milligram dose of CBD oil at the beginning of this, and my neck has stopped jerking, or it at least has slowed down an awful lot, and the intensity and severity is much easier to deal with when it does, because my muscles and my nerves are more relaxed. About the worst thing of my symptoms is I will have part of the same group of muscles cramp and part of it jerk, which tears the cramped part in micro tears and is extraordinarily painful. CBD helps alleviate a lot of that. And a lot of times I'm also very stiff, very hard to move, and hold very, what's called dystonic postures, which are unnatural, very odd postures that my appendages or trunk gets locked in, or my neck gets locked in. CBD also helps greatly with alleviating that. I compare it to, I feel like an old rusty tin man that's been left in the rain, and CBD, someone came along and finally oiled it, thank God. At night, THC helps me sleep. I'm an insomniac. I've been to the sleep clinic twice with an expert doctor. There was no help for me with a CPAP machine due to my emphysema and other problems and dystonia. Basically, I hit a dead end there, and high THC actually helps me sleep and get a decent night's sleep, at least 5 or 6 hours, as opposed to the 1 to 2 I would normally get.
Yeah. Do you find the improvement of your sleep is that an effect, or does it have an effect on your tremors? Does less sleep equal more tremors, or is there a correlation with sleep and tremor?
Absolutely. The less sleep I get, I will go through periods where I don't sleep very much at all. I was just in a move and had to sleep at my sister-in-law's house, so I didn't have my usual routine or space, which as an autistic person is very difficult to adjust to. I only end up sleeping 1 or 2 hours a night for 4 hours a day. And by the end of it, I looked like a fish out of water. All of my family said, wow, we never saw you like this. We get it now. Because I wouldn't go out on bad days, and on bad days I'd have my wife drive and I'd have an awful lot of CBD, so it helped to cover it up a lot.
Okay. And I mean, just hearing your story really highlights the multiple benefits of cannabinoid therapy in this particular situation. So, pain, reduction in tremors, improvement in sleep, and also improvement in anxiety.
Yes,
Traditionally, that might be 4 or 5 separate medications to treat each individual symptom. But here with CBD and THC, you're able to manage those symptoms just with CBD and THC.
absolutely. And I can say my family has noted a remarkable improvement in my attitude, and they say I seem to generally be a happy person now, even though I have some pretty serious diseases to deal with.
Yeah, yeah. And I mean, it's crazy, and we've talked about this, and of course, again, this is what doing this is all about, is raising awareness so that there will be coverage for these specific neurological conditions, as well as other conditions like dementia, autism, certainly anything related to cancer. But just maybe give us your thoughts on A, how much this costs for you to treat your condition, and B, do you think this should be covered?
Yeah, absolutely. Monthly, I am a bargain shopper of the best, and it still costs me approximately $1,000 a month. I am on many compassionate pricing programs. I have sent many emails to many companies about their high cost, and have compared company to company and sent that to the other company to try to drive the cost down. Um, it is very cost prohibitive, and it absolutely should be covered under drug plans. I believe it's a legitimate medication, as legitimate as any other pharmaceutical medication, if not more so.
Yeah. Yeah. And you've tried other of these legitimate pharmaceutical medications. And to me, of course, cannabinoid-based medicine, CBD, THC are medications. We shouldn't include them in some separate box. It's another uh, modality for treatment. But when you talk about the fact that you've tried these other things, gabapentin, right, the baclovins,
Yeah,
um, not not only are they covered, but they didn't help.
yeah. If I had to pick one, I need high dose CBD over the others. And I can tell you, 20 years ago, or earlier in my life, I was having a mental crisis and had many SSRIs, many antipsychotics, many other types of drugs. None of them helped. What I needed was to calm down with some CBD and get some therapy.
Yeah, yeah, exactly. And that is why it should be covered. And Matt, like, thank you. Just thank you for taking the time and sharing that story, because it's powerful. I think a lot of people can relate, and hopefully together we will make some progress on getting coverage for the people that
I
need it.
hope so. I hope so.
Right.